Good morning. Good afternoon, everyone. It was morning earlier, now it's afternoon.
That's because the plane was late. I'm sorry.
Good afternoon, everyone. My name is Elijah Tyler. I'm a native Memphian, and I've had the opportunity to live here my entire life. Today, I'm here to talk about my experiences with healthcare as a Memphian in order to possibly give more insight on healthcare in Memphis as a whole. My experiences with healthcare has come mainly from taking care of my mom. When I was in 5th grade, I had the unfortunate experience of witnessing my mom have a stroke. After that event, my mom was rendered unable to take care of herself. So my grandmother and I have been doing it. And doing that, we've seen firsthand the impacts of healthcare in Memphis. Today, I'm going to be addressing 3 things I've experienced as a caretaker and aide for both my grandmother and my mom. Those 3 things are access to healthcare, a poor person's apparent obligation to subpar services and treatment, and insufficient service by those considered healthcare professionals and officials. Primarily, it's essential to look at the issue of access. In certain neighborhoods in Memphis, access to various things on a whole has declined. In the part of Memphis that I'm from, we don't have any immediate places to eat or safe, clean parks provided by the city. That same problem is seen with healthcare. We lack sufficient medical support, be it from a hospital or clinic within a 15-minute radius. This presents a problem for multiple reasons. First, for someone with limited mobility, especially when taking care of someone with the same issue, driving yourself to healthcare could be a hassle. Moreover, even though transportation services are provided, those services aren't always ideal. Sometimes drivers aren't on time and are professional, or the vehicle is not ideal in itself, with larger vehicles providing added difficulty or even possible injury when just trying to enter the vehicle. However, what makes this issue even more depressing is the feeling that as lower to middle class people, we can't have a say in what goes on, that we're obligated to whatever services or treatments we can get. My grandmother has addressed in the past that we can't pay for services, so we have to take what we have. She recently addressed disapproval with medicines that she's been taking and seeing my mother take that did not seem to work. Some of these medicines were even on recall and had serious side effects that could lead to various bodily issues, including cancer. She questioned why healthcare professionals would even allow certain medicines and products to be administered, even though they sometimes have disastrous consequences. However, she felt powerless due to her financial state, and she felt that she really didn't have a voice in these issues. That same feeling links to my next topic of insufficient service of healthcare professionals. I've seen this mostly with my mom. Whether it's the aides who come to help my grandmother take care of her, or the doctors and nurses who help my moms in everyday treatment or dialysis care, it seems as though those professionals are ignorant to the condition of my mom and couldn't sufficiently treat her. I've witnessed many professionals who are unprofessional and have come to our house and made basic mistakes that people should be trained on, such as putting my mom in a hot tub of water, or not drying her completely, or not having their hair tied when they take care of her. It's clear that many people in the health industry haven't been trained to aid people in my mom's condition, which makes it even more difficult for my grandmother and has forced her to search for numerous agencies and leave agencies simply because caregivers seem to not know what they were doing. These problems demonstrate why we need better health care in Memphis. Thank you for listening to my story. Now, it is my honor to introduce someone who has taken on our country's toughest fights and won. Someone who has experience in business, government, and doing good that prepares him to lead. And now he's going to take on the challenge of fixing our healthcare system to ensure that people like me, my mother, my grandmother, and so many other people across Memphis and the world have access to affordable, high-quality healthcare. Ladies and gentlemen, Mike Bloomberg.
The answer to the question is 20 years old. If you do that kind of speech again, I'm going to be out of business. Elijah, thank you for sharing your story with us and for being here today. And I can just promise you we're going to do everything we can so that nobody else will have to go through this situation. And if we get it done, you will have been part of the solution. So thank you for all of that. Well, good afternoon, everyone. It's great to be here in Memphis. Earlier this week, I was in Charlotte, North Carolina. And before that, I spent a little time in Texas. But there's no truth to the rumor that I'm organizing my campaign stops around the places with the best barbecue. Now, I know some of you are still celebrating Memphis's big basketball win over Tennessee the other day. If there are any Tennessee fans here, just look at the bright side. At least you're not New York Knicks fans. Actually, by the way, the head coach of the Memphis men's basketball team, Penny Hardaway, actually played on the Knicks for a couple of years while I was mayor. That was a long time ago. I go to occasional Knicks game, and I just don't remember whether it was there. But it was only in my second term back then, and Donald Trump was only on his fifth bankruptcy. So it's other things to think about. Back in 1916, I warned that if Donald Trump ran our country like he ran his companies, we'd be in a whole lot of trouble. And I'm sorry to say that's exactly what has happened. Extorting a foreign head of state for campaign purposes is a gross abuse of power. And the House, I think, did its constitutional duty by impeaching him yesterday. It's unfortunate, it's terrible, but unfortunately, it increasingly appears that the Senate Republicans will not do their duty, and the issue won't be settled until November by we, the American people. And that's why 2020 is not just an election, it is a referendum on how to save our Constitution and let Trump light a fire on it. And that's just not going to happen. And that's why it's so important, I think, that we nominate the candidate who gives us the best chance to defeat Donald Trump and bring our country back together. Now, I don't know if you often see many presidential candidates in Tennessee. That's unfortunate because places like Memphis have different challenges and perspectives than other cities where all the other candidates are focusing their time right now. I believe our party has to put places like Memphis front and center, and that's what I'm trying to do in my campaign. Thank you. And one of the biggest challenges here in Memphis and across the state, and that's why I'm here, is health care. And if I'm elected president, health care will be right at the top of my agenda, which is my subject of the day. America pays much more for health care than any other country. And those costs are leaving millions of Americans without enough money to make ends meet. Last year, more than 8 million Americans were pushed into poverty by medical bills. Families sold homes to treat sick children. Others went broke paying for life-saving operations or started GoFundMe campaigns to raise money for a loved one's cancer treatment. It just breaks your heart. This is America. We're wealthy enough to provide people with health care. Why on earth don't we do it? Millions more Americans skipped doctor visits or didn't fill prescriptions because they couldn't afford it. That should not happen in the world's wealthiest country. It really is a mark of shame on our country, and rather than fix it, I think that President Trump has made it worse. When Donald Trump was elected, there were 28 million uninsured people in America. During his first 2 years in office, the number of uninsured people in America increased by 2 million. Tennessee has one of the highest rates of uninsured people in America. Why? And last year, the number of uninsured people here increased by another 50,000. Only 2 states in America had bigger increases. Today, thanks to President Trump, more Americans are at risk of catastrophic medical bills. More Americans have to choose between going to the doctor or putting food on the table. More Americans have junk insurance plans that don't cover maternal health or existing conditions. President Trump has spent 3 years sabotaging the American Care Act and offering Americans nothing in return but empty promises. He promised to repeal the Affordable Care Act and replace it with something better, but he has never had another plan. He determined to throw Americans off the boat without giving them a lifeline. He just doesn't care if you have a pre-existing condition. He wants to deny you access to coverage. If he is reelected, he'll keep trying to do that, and I think we can't let that happen. A famous resident of Memphis of my generation reportedly once said, "Truth is like the sun. You can shut it out for a time, but it ain't going away." Elvis, just in case you don't remember. I do remember the first time I saw Elvis on television. The truth about Donald Trump is this. He doesn't have the first clue of how to unite and create. He only knows how to divide and destroy. We can't accept that. Lives are at stake, and that's why I'm running for president, to defeat Donald Trump and rebuild America. And that includes fixing our healthcare system once and for all. Now, I know how urgent and important this issue is. Improving public health has been one of the fights of my life. When I was mayor, our administration led a major expansion of public health insurance, and we created new policies that increased life expectancy in New York by 3 years. When I left New York, life expectancy was 3 years greater than the rest of the country and 3 years greater than it was when I started there. My company offers the very best health insurance and the most generous and comprehensive benefits. I think that's good for our company. I think it's good for our employees. I think it's good for our customers. Every American deserves coverage and quality, affordable care, and we can get it done. To do it won't be easy. We won't take away private insurance as some candidates would. My proposal will instead build on what works, President Obama's Affordable Care Act. We'll make sure that people who like their private insurance can keep private insurance and also provide coverage to the unemployed. We don't need Medicare for all proposals that are more likely to re-elect Donald Trump than to expand coverage. So let me tell you what I'll do. I want to emphasize the word do, because to me, leadership isn't about making big promises, shouting into the wind, or shaking your fist at the world. Leadership isn't dreaming up a plan that can never pass Congress. It's about people coming together and getting things done. And let me tell you what I'm going to do on health care as president. First, every American will be guaranteed access to affordable health insurance. That means millions of Americans who don't have health insurance can get it and will finally achieve universal coverage in this country. Second, every American who already has private insurance will be able to keep private coverage if they choose, and they will see out-of-pocket costs go down. That's 175 million Americans who will be paying less for health care, and I'll tell you why afterwards. Third, we're going to expand the kind of care people can get, including by bringing dental coverage to millions of Americans who right now cannot afford it. Now, here's how we'll do all this. Let's start with universal coverage. Back in 2010, President Obama proposed giving Americans the opportunity to buy public health insurance. It's called a public option, and it's effectively a chance to buy into a Medicare-like policy provided by the federal government that is less expensive than existing options. I supported the idea back then. President Obama was right to push for it. And in 2021, working with Congress, I think we can sell Congress on passing it. We're going to get this done. To achieve universal coverage, we'll work aggressively to enroll uninsured Americans. I know we can do that because we did exactly the same thing in New York. During my 12 years as mayor, we cut the number of uninsured New Yorkers by 50%. And we can do it nationally by expanding outreach and simplifying enrollment. We'll also have a plan to deal with states that refuse to expand Medicaid under the Affordable Care Act. It's simple, actually. We'll enroll into the public office automatically anyone who is eligible for expanded Medicaid coverage. And we'll do the same for every American who is eligible for Medicaid but is not currently receiving it. That will cover another 2.5 million people across America, including another 244,000 people in Tennessee. The public option will make health care more affordable, including for Americans who already have private coverage, because it will drive down prices. But if we stop there, health care costs would continue to push people into poverty, and too many people would decide to forego coverage. You have to make a decision. Do I pay for my insurance or I do something else? That's not the kind of options people should have to make. So here we go further. And today I'm proposing 5 steps that we'll take to substantially reduce health care costs for all Americans. And I'll just mention each one briefly. 1, we'll have to cap hospital bills at no more than twice what Medicare pays for some services. Now, some states in America already do this, so when you say it can't be done, it certainly can be done. Right now, hospitals and other healthcare providers often charge patients with private insurance 4 or 5 times as much as they charge patients with Medicare, simply because they can. The insurers then pass those costs on to their customers in a form of higher monthly premiums, higher deductibles, and higher copays. By setting a ceiling that's tied to Medicare, we can bring down those costs for all Americans. 2, we will ban all surprise medical bills, which can happen when out-of-network doctors are hired by in-network hospitals, but the patient isn't told in advance. If you're in the middle of a medical emergency, you shouldn't have to worry about whether the doctor treating you is part of your insurance plan. But when you get home and you get a bill, you sure start worrying about it. 3, the federal government will cap your monthly premiums if you choose the public option, or if you buy private insurance in the marketplace and your premium amounts to more than 8.5% of your income. You'll get a government tax credit to reduce the private costs down to that level. 4, we'll charge a small fee to the private insurers to create a fund that will cover 50% of very high claims, say those over $100,000 for those tragic extra expense cases that you read about. This fund will help drive down premium costs, we think, by an average of 10%. Another step in the right direction of more health care, better health care, and not for very much more money, if at all. And 5, we're going to going to lower drug costs by doing what should have been done decades ago, allowing Medicare to negotiate with drug companies and cap prices for everyone, just like every other nation does. It's just outrageous that Americans pay many times as much as people in other nations for the same drug. And usually those drugs are developed right here in America, often with taxpayer-supported funds through the National Institute of Health. So we're paying for the development, and then we're paying more for those drugs. If anything, we should be paying less than the other countries. After all, we're paying for the research. We'll also eliminate drug company payments to pharmacy middlemen, which stifles competition and drives up prices for life-saving drugs like insulin. And we'll cap out-of-pocket drug expenses for people in Medicare. Now, as a candidate and as a president, Donald Trump said he was going to take the pharmaceutical industry on and lower drug prices. After 3 years, 0 progress. And this week he said he would allow states to import some drugs from Canada where they are cheaper. And that wouldn't work to lower drug prices. What are drug companies going to do? They'll get around it easily by just limiting supplies in Canada. But as we know, this president has a long history of not doing what he says he's going to do. There's an army of lobbyists in Washington working all day long to keep the broken, expensive system we have in place, and they make a lot of campaign contributions, unfortunately. By the way, if you look at my campaign's filing, you will see I don't take a penny from any company that has any connection with any health care whatsoever. And you know how certain I am of this? Because I don't take a penny from anybody. Somebody said to me the other day, "You're spending a lot of money." I said, "Yes, I'm making an investment in replacing Donald Trump, and it's the best investment I could make." Yeah. Now, in my administration, the lobbyists won't get past the lobby. I like that saying. But with the Trump administration, the lobbyists are winning, and not just on health care. Seriously. President Trump, for reasons I just don't understand, has rolled over for special interests again and again. He's done it for the pharmaceutical lobby, the gun lobby, the coal lobby, the e-cigarette lobby. Stop me when you get bored. And he wants people to think that he's strong and tough. Give me a break, come on. When special interests come calling, he purrs like a pussycat. Now, we need a president who has more courage than the cowardly lion. And I can just tell you, I've spent my career taking on the toughest battle and the biggest opponents, including Donald Trump. I've beaten him before. People say, "How are you going to beat Donald Trump?" I've beaten him before, and I'm ready to beat him again this November. One of the first things I'll do as president is to reverse President Trump's support for a law that would invalidate the entire Affordable Care Act. Just think about how irresponsible that is. The president has never proposed any plan for covering the 20 million people who would lose coverage. I don't know any business person who would manage an organization that way. And if they tried, they'd be fired. That's what we need to do, incidentally, next November. Change the presidency. This president has already done enough damage to health care in this country, including by introducing junk insurance plans that can bar Americans with pre-existing conditions from getting coverage. That means an American with high blood pressure, diabetes, or a disability can actually be denied health care coverage. In other words, the people who need health care the most are the ones most likely to be rejected. That makes no sense whatsoever. And as president, I'll restore rules barring insurers from excluding people because of pre-existing conditions. The Affordable Care Act was actually a major achievement that took us in the right direction, and President Obama deserves an awful lot of credit for that. But now, you can put, when I talk to him, I'll tell him you applauded. He'll be pleased. But now we have to finish the job, and we have to make sure that every person in America has access to coverage and affordable care. And I believe we need to go even further in a number of important ways. For instance, each year, a third of Americans don't go to the dentist because of the cost. So we should expand Medicare to cover dental care, as well as vision and hearing care, and require that states cover dental care for people on Medicaid. We'll also take important steps to strengthen health care in rural communities, and that where it has been decimated by many states' refusal to expand Medicaid. A third of the people in Tennessee get care at rural hospitals, but 10 rural hospitals have closed in Tennessee since 2012, and another 15 could be at risk. That means people have to travel further for care, including emergency care, or not get it at all. And that's true in states across this country. As president, I will stop the bleeding and bring back care to rural communities. We will increase and stabilize federal funding for rural hospitals and double funding for community health centers so that they can provide mental health, dental health, and substance abuse services, which God knows we need. We will also give community hospitals incentives to take other steps that improve patient health, including help to get them to and from doctor's appointments. That's a problem for people in rural and urban communities, and our plan will help Elijah's family and many others like him get the quality care that they need. I'll also launch a comprehensive national effort that focuses on preventing disease and stops the decline in life expectancy that has happened in recent years. For the first time in history, life expectancy has gone down 3 years in a row. So it's just an amazing statistic, up every place else around the world, down 3 years in a row since World War I, in all fairness. Because the most important thing we can do to improve health and reduce healthcare costs is preventing people from getting sick or injured in the first place. In the coming days and weeks, I'll outline a plan to address the problems that are cutting lives short in our country, including the opioid epidemic. We have an overdose and addiction crisis in America, and the president isn't going anywhere near enough to get things done. I've been working on this issue through my foundation, and I'll outline an aggressive plan for preventing and treating addiction and saving more families from the heartbreak of losing children to drug abuse. It is just unbelievable what is happening with the drugs in our country, even high schools. Now, any candidate can talk about a plan, but what I think I offer is leadership and a record of changing big plans into reality. That's what we did in New York. That's the job of being president, and that's the message I think we need to beat Trump. Voters are tired of politics as usual, and that's why many voters turned to Trump in 2016. But as many people have come to see, Trump is all talk and no action, or as they say in Texas, all hat and no cattle. Although it might be more accurate to say, all hair and no cattle. I'm a doer, and we have a lot of work to do. I'm ready to roll up my sleeves and get working. I was lucky enough to be mayor in New York City at 8 million people and 300,000 employees, the most progressive city in the country, and we made an enormous difference. And I hope you'll join me because I think we can do the same thing all across this nation. So thank you for coming out, and I look forward to spending more time in the great state of Tennessee. Thank you all. Thank you.